Hi there, Dr. Katz here. So, in this episode, let's talk about intermittent fasting. Lots of people are very interested in intermittent fasting, and there have been many reports written about it. But what is it exactly? So, the correct terminology is called TRE, time restricted eating, which is what it sounds like. You restrict your eating to a certain window. Now, some people are more vigorous about it, so they do 6 hours of eating, let's say from 12 p.m. till 6 p.m., and then 18 hours of not eating at all. Others are a little bit more lax and do the 8 hours and 16 hours. That's one form of intermittent fasting. There's another form. It's called the 5-2. The 5-2 basically means you eat normal for 5 days, and then on 2 non-consecutive days, you markedly reduce your calories, about 500 to 600 calories a day. So here's the question. How does it compare restrictive eating, i.e., calorie counting, versus time restricted eating? Which one is best? Well, let's take a look at the data. There was a recent study that was published. It looked at approximately 90 patients. It was a randomized controlled trial. They took a group of patients that were considered control. They were able to eat whatever they wanted. They were given general advice on healthy versus unhealthy. That was group one. Group number two were the calorie restricted group, and they had to reduce their calories by 25%. And group number three was the time restricted group. So they did this, and over the next 12 months, here's what they found. And what they found is in people they did the time restricted diet, on average, they lost about 10.5 pounds in 1 year. The people that did the calorie restricted diet lost approximately 11.5 pounds in 1 year. So very, very similar. They did find that the blood sugars became better in both groups of people, but as far as actual weight loss, very similar. There was another study, and what it's called a meta-analysis. They take many smaller studies, put them together, and this way it provides a larger number of people to look at. So this study did the same thing. They looked at people that did the time restricted versus the calorie restricted diet, and they compared them head to head. And it was essentially the same story. The weight loss is very similar, about 5% of your total body weight. So to put it easier for you, 200-pound person would lose about 10 pounds. Now the catch is once you stop doing the time released eating or intermittent fasting, people tend to gain their weight back. So, as always in life, it's not the name of the diet, what's the diet, it's more can it fit your lifestyle. Remember, you should never have to make your lifestyle fit into the diet. We all know that's not going to work, not long term. But if you can make the diet fit into your particular lifestyle, now you have a legitimate chance of making it a long-term change for you. How do you do this? What's the better way to incorporate this? Well, for starters, you need to start slowly. Why go for the 6 hour window for eating and 18-hour window for not eating? If anything, psychologically, it's really hard knowing that at 6 p.m. you finish eating and you're not allowed to eat anything until 12 p.m. the next day. Why not just start with a 10-hour window? For argument's sake, your first meal is at 10 a.m., your last meal is approximately at 8 p.m. And then from 8 p.m. till 10 a.m. the next day, you don't eat anything. You can do that for about 1 week, even a month, and then go to the 8 and 16 window, and eventually to the 6 and 18 window. That will be far more tolerable. Also remember, you cannot, during that timed window, you cannot eat unhealthy or processed food. You also have to be careful. You need to eat, but you can't gorge yourself, knowing that, for example, the last meal will be at 6 or 7 p.m., eating a large amount of food because you know you're not going to be eating till the next day. So that's not a smart move. So just make sure you eat normally when you're doing the intermittent fasting, but stay away from the garbage, and you know what it is. When comparing the calorie restricted and the time restricted intermittent fasting, I do think intermittent fasting is much easier. You're not sitting there counting calories, wondering, well, what I just ate, how many calories did it have? Did it represent one portion, one serving, two servings? That can be difficult. Now, some people who have been doing calorie counting for a long time, that's more natural to them. And so that may very well work best for them. For the average person, I think intermittent fasting is a great tool that you can utilize to restrict the amount of calories you eat and to help you lose weight. And don't forget, it's a combination. It's not just are you doing intermittent fasting? Are you cutting out calories? It's the food you eat, how much you eat, are you exercising? And in this day and age, we know that medication also helps. While not everyone needs to be on medication, but above a certain weight, it certainly becomes difficult to lose substantial amount of weight. So that combination of proper eating, exercising, and medication will give you your best approach. I wish you all the best. I hope that this works well for you. Looking forward to seeing you soon.